Good afternoon. This is Dr. Doreste with the Cranial Release Technique. It's 12:20 on Wednesday, May 29 here in New York City. And I just wanted to follow up on our last few discussions having to do with the autonomic or automatic nervous system. All the functions that we do not have to consciously be concerned about. And I will link this image below in the description. This comes from the Merck manual, which is a textbook that we all used in chiropractic or medical school, dental school. And again, this is just showing the sympathetic and the parasympathetic nervous systems and how all the organs and glands have both a sympathetic and parasympathetic innervation, so that balance is the key. When you need sympathetic, you want that system to be fully engaged. When you need parasympathetic, obviously you'd like that system to be fully engaged. So it's only a few slides, and I just wanted to go through a few things with you, and then we'll wrap it up at the end with the CRT application to all of this. So let's have some fun. And again, I will link these pictures in the description below. So the sympathetic innervation, remember the fight or flight side of the nervous system. The sympathetic division is part of the autonomic nervous system, the part of the nervous system that works automatically or autonomously without a person's conscious effort to regulate internal body processes. Generally, the sympathetic division prepares the body for stressful or emergency situations, fight or flight. For example, it increases the heart rate and the force of the heart contractions and widens or dilates the airways to make breathing easier. So when you're in an emergency situation, you want the nervous system to be fully charged so that you can run from the animal, run towards the animal, run up a tree, run away from whatever it is that's happening, or if you have to confront the situation, you want to be fully turned on and ready to go. That's the sympathetic nervous system. Again, that's normal, that's natural, depending on the state of events that's happening day by day, moment by moment. Well, the flip side of that, of course, is the parasympathetic innervation. And it goes down to say the parasympathetic division is part of the autonomic nervous system, the part of the nervous system that works automatically or autonomously without a person's conscious effort to regulate internal body processes. The parasympathetic division regulates body processes during ordinary situations. Generally, it conserves and restores. For example, it slows the heart rate and decreases blood pressure. It stimulates the digestive tract to process food and eliminate waste. So again, you're sitting having dinner with your spouse or your kids or on your own. You don't want your heart pumping, ready to run. You don't want the eyes wide and ready to take on a predator. You want to be sitting, relaxing, digesting, building, repairing the body. That's the parasympathetic nervous system. So these two work in balance, and it's a perfectly orchestrated system of things that we don't need to be concerned about. So if we go over to the fourth slide, they again just do a little review of the divisions of the autonomic nervous system. And the sympathetic, again, increases the heart rate, the force of the heart, releases energy stored in the liver so that you're ready for the event. You're ready, you have the fuel ready to go. The speed at which energy is used to perform body functions while a person is at rest. So you're sitting there relaxing, and all of a sudden you hear a rock breaking through the window. Well, you jump up and you need your body charged up to see what's going on. That's shifting you from parasympathetic to sympathetic. And to increase muscle strength, right? To prepare you for the event. It widens the airways to make breathing easier, causes sweaty palms. Many patients would ask me, why would my palms get sweaty if I'm in sympathetic dominance? Well, that little bit of moisture in the hands will make gripping an object easier. Whether it was a baseball bat to play baseball, whether it was to climb a tree, to do whatever you need to do, greater hand strength and dexterity. The next point, it decreases functions that are less important in an emergency situation. So digestion, urination turns off, preparing you for the event. And it also controls the release of semen and ejaculation. So those are all part of the sympathetic nervous system. Again, the flip side, the parasympathetic nervous system stimulates the digestive tract to process food and eliminate wastes. Normal, natural relaxation slows the heart rate, reduces the blood pressure, controls erections. Again, this is all the biology of how we're put together, how we're wired up. And I'll never forget, when I first really started bringing cranial release into the practice, I really wanted to get the word out, and I attended a meeting about health and wellness, and all the participants only spoke Spanish. And at that time, my Spanish was not so good. I had 3 years in high school, but I went, I did my I did my best to explain the concepts of the cranial release technique and how receiving cranial release just makes sense on a regular basis. And so I'll just flip back to that original slide because I happen to like that slide a lot. And at the end of the lecture, a gentleman came up to me, and I would say, if memory serves me right, he was probably in his mid to late 50s, and basically was telling me that he was unable to achieve an erection. Now, this is before the term ED, erectile dysfunction, even came out. This is before any of the medications came out that I'm aware of. And I said, well, quite honestly, it's under neurological control. Again, this is in Spanish, speaking to the man. This is all under neurological control. And if cranial release can help to balance the nervous system, then in theory, I don't see why it couldn't help. So he decided to come in and have a consultation with me. And I evaluated him, and I did determine that, yes, cranial release would be beneficial by looking at his cranium and seeing cranial distortion, one eye small, one eye low, ears rotated, all the things that I normally look for, postural distortion. And he received his first CRT from me. Now, at that time, I was practicing in Flushing, Queens, and he was coming from the downtown Brooklyn area. So it literally took him by subway and walking to my office, I'll say door to door, approximately 2 hours. So he came, received CRT, went home. Again, the CRT took all of about a minute. Went home. And I'll say it was a Monday, if memory serves me right, and came back on the Friday for his second visit. And when he came back on Friday, he was very excited to tell me that for the first time in his life, now here's a man that's, I'm going to say somewhere 57, 58, 59 years old. He's telling me that for the first time in his life that his teeth now matched. He had some sort of an overbite, and his whole life his teeth never matched, and he was able to chew and swallow his food with much more ease, and he was very surprised that after this one-minute technique, the very first one, he was aware of this change, and he had seen dentists and specialists and had gone through some other different therapies. But he was completely blown away by that fact. And I had heard that before, and I had done other YouTubes on CRT's ability to rebalance the TMJ, or the temporomandibular joint. So a few visits later, again, he spoke virtually zero English. So our visits were in Spanish, and sometimes with an interpreter if it really got to be technical. But I would say on the 5th or 6th visit, and I'm seeing him once or twice a week, but just because it took him so, I mean, it was literally, it took, a 4-hour, 2 hours coming, 2 hours going. So it was a 4-hour trip for him to lay on the table for 1 minute. So you can think about that for a little bit. And again, why would someone do that and pay out of pocket for that unless there was obviously some benefit that he felt? So I would say the 5th or 6th visit, I asked him about his original complaint of the erection issue, and he basically said, no problema, todo está bien, which means there's no problem, everything is good. And he stayed with me, I'll say, up until I moved away to Florida a while back. And I referred him to a friend of mine who does CRT in Manhattan. So to this day, he's still receiving CRT, and that's got to be close to 15 years now, off the top of my head, I'll say. So it just goes to show you what appears to be, as I discussed yesterday with Dr. D'Ambrosio, what appears to be a simple 1-minute cranial technique can do. It can rebalance the sympathetic and parasympathetic nervous system without drugs, without surgery, and it's a wonderful, wonderful technique for patients. Well, in my opinion, for everyone, whether you have a health problem or you don't, whether you're seeing other practitioners or you're not, for whatever, it's something to be done on a regular basis to balance the nervous system, to optimize function. I hope you enjoyed these few minutes reviewing the autonomic nervous system. This is Dr. Doreste with the cranial release technique. Again, the website cranialrelease.com. And for practitioners, those that would like to learn the cranial release technique, you can visit the website cranialrelease.com and click on the online training button to learn how you can learn about CRT in the comfort of your home or office. Thank you so much. This is Dr. Doreste. You be well, my friends, and adios.